Arthritis of the spine. Are you an artificial disc candidate? Now, a lot of people will tell you, a lot of doctors will tell you, you have too much arthritis in the joints of your spine or of your discs, and therefore you're not an artificial disc candidate. The reason they tell you that is when the trial was done with the FDA to get the approval of the disc, they left it up to the discretion of the surgeon to decide if your arthritis was too much or not. They didn't want the terribly arthritic spine in the trial because they're trying to assess the health of the discs compared to the artificial disc. So, as time has gone on, and I've had a lot of experience now over 12 years of doing artificial discs, we are using the artificial discs with more and more arthritic spines and still getting great results. So I would say, in general, a lot of arthritic spines still can be treated with artificial disc replacement.